If I were to ask you, how many fingers have you got? The natural response would be, what are you asking? Are you saying I don't know how many fingers a human has? Interestingly, most of us will say we've got 10 fingers. Well, anatomically, that's not exactly right. Welcome to my YouTube channel. I hope you have had time to watch previous episodes and you're learning a lot medically. Today I'll be speaking about a condition called carpal tunnel syndrome. I always like to define terms. Now, we know what a tunnel is, usually an enclosed space, and then sometimes you could go through a tunnel when you're driving or in a train. The body also has tunnel, and one of them is right there in the wrist, somewhere around there, called the carpal tunnel. Now, with a tunnel, it means there's a limited amount of space, and so structures go through that tunnel in the body. You have tendons, you have nerve, and so if for any reason that space accepts any additional structure or fluid, it therefore means that some of the structures will become compressed. And whenever a nerve becomes compressed, there will be problems. And so picture in your mind that wrist where there is a tunnel and then you have tendons. If conditions such as pregnancy, hypothyroidism is when the thyroid becomes underactive, rheumatoid arthritis, and some other conditions cause some form of problems at the level of the carpal tunnel, which is around the wrist. It therefore means that the nerve that goes through that tunnel, called the median nerve, becomes compressed. Because of that pressure, you begin to feel pain, numbness, and tingling sensation. Now, for us to appreciate where or the anatomy of what's going on, I need to explain a few things. If I were to ask you, how many fingers have you got? The natural response would be, what are you asking? Are you saying I don't know how many fingers a human has? Interestingly, most of us will say we've got 10 fingers. Well, anatomically, that's not exactly right. I'll explain to you. We have 10 digits, but not 10 fingers. Did I hear you right? Absolutely. We have 10 digits, but not 10 fingers, and I can explain that to you. If you check very carefully, if you look at your fingers, you observe that you have 3 bones. In these ones, 1, 2, 3, 4, you have 3 bones making up each digit. Now, if you look at the thumb has 2 bones. So the thumb is not described or mentioned as a finger. Each of them is referred to as digits, and so you have 5 digits on the right hand, 5 digits on the left hand, making 10 digits, but you've got 4 fingers on the right hand, 4 fingers on the left hand, making 8 fingers. And so you actually have 8 fingers, but 10 digits. And then, if you still are in doubt whether this is correct, why do you refer to this finger as the index finger and not this? Because this is actually the first finger and not this. Enough of a little bit of anatomy. Now, in terms of the presentation when the median nerve is compressed, the median nerve will usually supply the thumb, the index finger, digit, and half of the ring finger. And so for patients that have carpal tunnel syndrome, they will feel pain, tingling sensation in these 1, 2, 3.5 digits. What do we do for patients that have carpal tunnel syndrome? Number 1, you need to address the underlying problem. If the patient has, say, rheumatoid arthritis or an underactive thyroid, it's important to have these treated. In addition to this, you could divide the treatment for carpal tunnel syndrome into 2 main aspects. Number 1, pharmacological, non-pharmacological, and then surgery. Now, non-pharmacological will mean seeing the physiotherapist or an occupational therapist where you'll be giving splints. This could help. And then in terms of pharmacological therapy, you could use analgesics, sometimes steroids, and then sometimes steroid injections into the wrist to give some response. However, if these fail, it's necessary to see an orthopedic surgeon where a surgery will be carried out to release the pressure in the carpal tunnel. And so today we've learned that carpal tunnel syndrome is due to compression of the median nerve. We've also learned that we have 10 digits and 8 fingers. I hope that sticks. Thank you and subscribe. Bye.